pain that I had was a very sharp stabbing pain in my shoulder, and had been building up for several months. That I thought was just a muscle pull, but then playing racquetball, certain movement, I felt an exquisite, sharp, burning, stabbing pain that radiated down my arm. And being an internist, I knew that I had a neurological injury and called a nurse friend of mine that works in surgery and knows every surgeon at the various hospitals, and Dr. Cattorini was the first name she mentioned.
Because he had a soft tissue disc at one level, one side, and not a lot of other degenerative disc disease at other levels, but one level cervical disc disease, he's a great candidate for cervical artificial disc, and that's what was offered.
And I trusted his recommendation because of the reputation that my friend and other nurses and doctors had given me.
The operation starts by localizing the disc space on the cervical region. A cervical incision is made approximately an inch or two in the cervical region. We could dissect then cleanly down to the front of the spine. Once down to the front of the spine, we remove the disc. Once the disc material is removed and the nerve roots freed on both sides, the artificial disc is then inserted into place and stabilized in this particular version of the artificial disc.
He was right on the money. It started immediately, the pain was gone. And that was my biggest concern at the time, because I couldn't work. I can't see patients when I can't function.
His weakness in his left arm improved. He was able to get the strength back with physical therapy and back to playing basketball.
So I'd recommend him, and I have over the last couple of years since my surgery, a number of times.